Hi, we're at the clinic at Pacific College of Oriental Medicine, and we are here to tell you about beginning of shift procedures for cleanliness of the premises. So we want to cover with you what needs to happen in the room before a patient arrives. You cut it.
Hi, my name is Jason, and the first thing you want to do when you come into the clinic room is you want to sweep the floor to make sure there's no needles left on the floor, because that could cause a serious issue for not only yourself, but the patient too. And the first thing you want to do really is to look at the magnet and to make sure there's no needles on it. You don't want to touch the magnet either, just in case there is any needles. And after that, you just want to go ahead and sweep the room with the magnet. So you try to get every area of the room and just sweep to see if there's anything. Now, if there is a needle, you'll hear like a click sound, but sometimes you might not. So you just want to, after sweeping the room, you want to take another look at the bottom of the magnet just to make sure there's no needles there. So I'm just sweeping around the room, trying to get every area. Just like that. And then I look again to see if there's any needles. Nothing's there. Okay. And another thing I like to do is I like to lift up the table and sweep in between here, because if a needle falls in between here, you do not want to go in and wipe that first with there being a needle there, because it could get stuck also. And then I look again, there's no needles in between there, nothing. And then that's it about sweeping the room with the magnet. Thank you. Hi, so the next thing you want to do after you sweep the floor for needles is you have to wipe everything down. So what I like to do first is take a paper towel, spray it on there, wipe down the door handles, because patients and you touch it too, so you don't try to get all the germs off there. Also like to wipe the light switch too, just in case, you know, that gets kind of dirty and could get germs also. So after you do that, you just want to go ahead and wipe everything down here also. So what I like to do is spray on everything like that. I also like to spray the sides too, headrests, all the way around. Because a lot of times the sides, when a patient goes on and off the table, they grab onto the sides, getting on and off. So you gotta make sure you wipe that down too. So you just wanna wipe everything down really good. Around the headrest, all the way around. And then you wanna go ahead and wipe down the chairs also. Spray it on. In there. Just give it a quick wipe down. And then the last thing you want to wipe down also is the bolster. Just give that a quick wipe too. Now when it comes to this is the cleaning field, so you don't want to put anything on here except the alcohol here and the cotton balls. But this thing also has to be wiped down too. So what you want to do is put this stuff aside, spray it down, wipe it down. Make sure it's nice and clean. And then what you want to do is take a paper towel, just like so, rip it this way so this part is clean, it's never been touched, and lay it that way. So then you put everything back the way you found it, right like so. And the only thing that goes on here is needles, nothing else. So the alcohol, the cotton balls, that's it that goes on here. Next step would be to make sure that you have all your supplies for the whole entire shift. So these are papers to go over the pillows for each time you have a client. And then here's blankets in case they get cold, some towels. And these are the gowns for the patients too, just in case they have to take off their shirt or their pants or anything like that, they'd wear that. So pretty much you need 3 of these, just in case you have 3 clients. And then here is paper that you use to go over the table, because every time a patient comes in, you got to put this back down also. And then you just lay it out. And let's see, if you need anything, you have to go to the front office. So gowns are at the front office, towels are at the front office. In case you need to use a sheet, in case the patient is germophobic or something like that, you also have to go there to get the sheets put on the table too. And you just got to make sure that you always are prepared beforehand. Make sure that you have paper towels, sanitizer, and any other ointments that the acupuncture might need in turn, because you don't want to come like later on and figure out that you're missing something when you really need it right then and there. So moxibustion, stuff like that. Okay, and that's about it for the cleaning procedures. Thank you.
Okay, Jason has told us about the procedure setting up the room at the beginning of the day for cleanliness, and now we're going to have Sammy come in and tell us about, in between patients during the middle of the day, what type of cleanliness procedures are going to happen here in the room.
One.
Hi, I'm Sammy. I'm here to show you the procedures for in between patients. So you want to come in here, make sure you clean this up. There's usually a pillowcase on the pillow, so you take that off, throw all these things away. You would take the paper towel from the clean field, throw that into the trash. And if there are any unused needles, open needles, you would dispose of them into the biohazard disposal container. And then after that, you would go and get the sanitizer, just like Jason showed you. You spray everything down. You don't have to be as thorough this time just because you have limited time, you're in between patients. So you spray down the table really, and as you're doing that, you lift this up to make sure that there aren't any needles in there to avoid a needle stick. And then after that is done, you would get the roll for new paper, roll that out onto the table, rip it off, and put a new pillowcase on. And that should do it.
Okay, so Sammy has told us about during the day when we have patients in the clinic room here being treated, what the procedures are in between those. And now we have Kiera come in and tell us about, at the very last shift of the day, the last patient, what the cleanliness procedure is to close down the room for the day.
Okay, so now it's the end of your day. You want to clean up the room. So throw away anything that is on the table, the paper. If there is a pillowcase that the patient used, you also want to throw that out. And clean your table with the disinfectant and the paper towels. You can get ready the table for the morning to be cordial. You want to get your sweeper, sweep everything out with the magnet, so to make sure that there's no needles either. And then you also want to check the room, make sure that everything is tidy. So for example, now we see the gown being not folded. So you just kind of tidy everything up, make sure there's gowns, make sure that everything is in order. You have extra pillowcases, things to clean, and then you also unplug any light. And Lynn always tells us, do not tug on the cord, actually unplug it from here. If there is a heat lamp, you also unplug that. And that's it. And then you're done with your shift.
One.
Okay, so now we've gone over the 3 different cleanliness procedures, how we set up the room at the beginning of the day, how we take care of the room and cleanliness between patients in the middle of the day, and how we close out the room at the end of the day to make sure it's ready for the next shift on the next day. The other thing we do just right before we turn off the lights is make sure that there's nothing left behind. There's no patient information, a patient hasn't left something. If it was, we would turn it into lost and found at the clinic office. But pretty much we've told you everything that needs to happen to make sure our patients have a safe and sanitary customary time here at the clinic.